All right, welcome back. Yes, our guest is Dr. Funmi Adeniyi, an astute dentist with more than 11 years of experience in private dental care and holds a Bachelor of Dental Surgery from, of course, the prestigious College of Medicine, University of Lagos. So all things all about dental care and healthcare. Welcome to the show. It's good to have you. Nice. There's a lot going on, and the month of April, that's last month, was Oral Cancer Awareness Month. I know that a lot of people don't even know about oral cancer. They may know about normal cancer of the breast, but oral cancer is a bit difficult for people to comprehend. Okay, so tell us about oral cancer. What is it?
Okay, so oral cancer has to do with malignancies that occur in the oral region, your tongue, your gums, your under your tongue, your cheeks, that's your buccal mucosa, the oropharyngeal area also, that's your soft palate, your throat. Yeah.
Wow.
So what are the predisposing factors?
Predisposing factors, well, there's the genetic factor, then there's the lifestyle factors of using tobacco and alcohol. So tobacco and alcohol are the most implicated in the oral cancer. Also the human papilloma virus, which is transmitted usually through sexual intercourse from mother to child during delivery. Yeah, really. But now there are vaccines for the human papilloma virus, and that should help going forward with that. Yeah.
Okay, now I know that when it comes to oral health, a lot of people are not really aware of their oral health. Yeah. It's a big challenge because brush my teeth and but there's a lot going on,
a whole lot
on right inside. So how can people, what are the things that people need to know about their oral health?
Okay, first thing to know is that your toothbrush is not enough.
Yes.
Your mouth is a mirror to your body. Your mouth shows us everything happening in your body, and so you need to pay attention to everything that's happening in your mouth. Brushing, flossing daily is important. Toothpicks are dangerous to you, so you should ditch toothpicks. Visit your dentist every 6 months because they are trained to get rid of plaque, calculus, dirt that your toothbrush cannot get rid of, and they can prevent gum disease, which predisposes to many other health conditions: stroke, diabetes, Alzheimer's. There's just a whole lot that poor oral hygiene predisposes
So let me take you back to what you said about throat cancer. Can that be? Yeah, I want to do it.
Is it similar as throat cancer?
Oral cancer.
Okay, so there's the oral cancer, then there's the oropharyngeal, but because they're happening in the same area, usually there's just this mix. Yes, it's interwoven eventually.
So how is that even detected? Because I noticed that a friend of mine was telling me about a friend of hers who died of throat cancer, and I remember what's his name now? The late Sound Sultan died of that as well. I mean, that is something that we're beginning to see, happen quite frequently. What are the signs to that?
Okay, usually when you notice a sore that's not healing around your lips, your mouth, you notice a reddish spot that just won't go away, you have pain from the area, or you have an ulcer of some sort in your mouth, if you notice swelling, pain, discoloration, jagged edges around this ulcer, or you notice that you're constantly having a hoarse voice, like it seems like your voice is always going, that might be an indication. Or you have facial pain, or you have lymph nodes that are just permanently swollen and painful. These are all indications that there's something amiss.
Going on.
So you need to visit a dentist. Usually a dentist will first detect oral cancer because they are trained to know what is right, what should be in the oral mucosa. Yeah, really. Next in line will be the ear, nose and throat doctors also, but very few people go there unless they are referred to the ENT surgeon. So really, yeah.
I mean, interesting stuff. Interesting. It's kind of scary at the same time because when we're talking, I was like, throat cancer again. How is that even a thing now? People are beginning to, people who don't even smoke or drink are people coming down with such situations. But talking about oral care, what are the would I say procedures now in taking good care of your dentition? Let me give you an example. So I used to have very white teeth. I use the word used to because I was speaking to somebody over the weekend, and I showed her, I did a picture and I showed her this used to be my teeth as a 2020. Look at it now. I'm not sure what's going on. And I still do my regular morning and I don't miss it, morning and night brush. I don't do mouthwash anymore. So how can I get my whiteness back? And what has happened?
What
really?
has happened? Okay, over time, usually
That's
with
what
with our diets, palm oil, you're taking
It's
Fanta
palm
every day,
oil.
you're doing colored drinks, colored food. That it tells
Builds
on the
up.
teeth eventually. So your routine 6-month cleaning would help to reduce that effect. And then there's the procedure of cosmetic tooth whitening also that can help to boost the brightness of your teeth. But really, eventually, over time, the human teeth darken with time because of use and wear and all that is exposed to, really.
That's interesting. So let's talk about the teeth whitening part.
Right.
Is that a safe procedure?
If it's carried out by a dentist who knows what they're doing, a lot of people now just submit their mouths to whoever claims can do whatever.
Yeah.
But dentists are trained to know what is right for your mouth, what percentage is right for your mouth. There's some mouths I look into and all they come in is they want whitening, and I'm like, sorry, you cannot get tooth whitening done. If you come in with compromised teeth, you have cracks on your teeth, you have holes, you have cervical abrasion that's from brushing hard, you've displaced all the edges of your teeth and they're exposed. Once you have tooth whitening, what I'm sending you to is permanent, a case of having permanent headaches. And so there's some people that should not get tooth whitening done, but eventually if you visit a trained dentist, you would not be at risk of all these issues. Really.
Because there was oral cancer awareness
Yeah.
month, what are some of the things that were done? Because a lot of people are not really conscious of their oral, they just brush. So what are some of the initiatives or things that have been happening to encourage more people to see a dentist? And they may say that the cost of seeing a dentist is expensive.
I like to say that neglect is more expensive than visiting a dentist. Because say you see a dentist every 6 months, twice in a year, all you're doing is paying for probably your consultation and your basic cleaning. Once there's a cleaning done, the dentist can notice everything that is amiss in your mouth. You can prevent whatever it is. And so prevention is better than curative procedures. So I like to say that in the long run, prevention is cheaper. Visiting your dentist regularly saves you a lot of money. It saves you a lot of time. It saves you a lot of stress. Oral cancer, when detected early, can be prevented via surgery, via chemotherapy, via radiotherapy. And so the onus is on people to visit dentists, and for dentists to also inculcate oral cancer screenings into regular visits, which is becoming really popular.
Because if I mean, for one to start seeing signs, what we call symptoms, right? It means that it's already getting to a late stage. So, but if you take the step to go see a doctor or a dentist, and that test isn't done, you know, what is the idea behind it? Because I mean, I go see you to detect something and then you don't detect it. So the question is, do you have more dentists now beginning to look at this oral cancer thing as a thing, and not just the general, let me check your cavity and see if there are any injuries or wounds or anything?
The thing is, in the natural process, in the routine process of examining your mouth, we see things that should not be. And so if there's anything that is amiss, there's an ulcer, there's a non-healing sore, there's a swelling somewhere, we notice it during routine examination. So it's something that happens, then the onus is on you to go forward, because we would advise, would you like to get a biopsy? Would you like to get a CT scan? And some people are just like, no, it just came a few weeks. And people tend to lie about their health. They want to pretend like everything is fine. And also, in the end, dentists are trained to detect. And if you visit a qualified, you're sure
How do you
it's
know
a
if it's
dentist,
qualified or not?
just ask.
Because I've had my tooth removed. I had to go to general hospital to do that.
Okay, definitely. It's a
And it
qualified
was,
dentist that is seeing
it
you
took 1
there.
week for my mouth to heal. And I also had like a...
But the thing is, if you were visiting your dentist every 6 months, we would have nipped it in the bud when it was just the hole. All you'd have done is a basic filling.
Okay, because they had to remove the tooth.
Yeah, so these are the issues.
Well, I think I need a basic filling because no. I had this tooth filling in I think it was GSS something. I'm not too sure, but now it's broken. I can feel.
No, there's no. Well, it depends on the degree of
working.
it depends on
One
the
side
degree.
is gone.
So,
I can feel one side of my teeth.
why should
inside.
you live with that? That's
I
not
mean,
normal.
I don't feel anything going around with it. Like,
Anyway, I think that we're going to come for consultation, because me too. I think I have a whole in consultation, but on a different, you've inspired young girls. From what perspective? Was it oral health?
Inspiring.
You've inspired young girls. Yes.
Okay.
Oral health perspective too.
Well, probably, and different things. I do a lot of things. So I write. I run some shows once in a while on my YouTube page.
On oral health too.
Oral health and general life also, business and family really. So yeah.
What is the quickest way? I use the word quickest for those who pretty much have that problem. They brush, but the mouth odor will not just go. They use mouthwash.
I use a mouthwash. I use a floss. I use.
So what is it?
what is the order of things?
Yeah, to take out that, because some people have dangerous mouth odor. Dangerous, I can injure you.
That's a different conversation. What can be done for that?
Let me share an example, quick one. So there's this guy, he was talking close to me, and then he wanted to tell me something. Literally, I almost passed out on his mouth. It was that bad. Like I literally lost my breath.
Maybe the question should be, what can people who have mouth odor do? Briefly to.
Okay, so the thing is, mouth odor, there are different causes. So there's the physiological, you just wake up in the morning, that's a physiological mouth odor, or you've not had water all day, or you're fasting. Those are physiological causes. Once you eat and you take water, it reverses. There's mouth odor that is caused from having holes. So you have a hole in your mouth. What's happening is bacteria is acting on food. There's decay. There's literally a decay. There's a locus of decay in your mouth, and so mouth odor will come out from there. If you sometimes, when there's systemic illnesses, you have diabetes, you have a liver condition, you have reflux disease, esophageal issues, anything happening in your respiratory, digestive system, there's a lot that happens there and that causes mouth odor. No matter how much you brush and floss and use mouthwash, nothing is going to change. So you need to cure that underlying condition. If you have malocclusions and you have crowded teeth and food is hiding between those teeth, you need to see a dentist. Sometimes we have to tell them all you have to do is get braces or aligners to correct your malocclusion, to make sure that there is no hanging conditions.
Why is this so exhausting for you? This
build up of it in our individual teeth.
Why you so emotional?
You know what? This mouth is very important. Imagine all the things that are going on everybody's mouth.
Sorry, did he complain that you had a bad breath over the weekend?
I don't have bad breath. I have good breath.
Did he complain?
Who is he?
I don't know, because you're just giving me all sorts of emotional vibes.
I'm just doing that for a lot of other people I've seen, because I also think I have a hole in my teeth that I need to, because when I eat meat on this side.
So that's the insecurity you have. You must have.
It's not an insecurity.
He must have
But we need to wrap up. Thank you so much, Dr. Funmi. We definitely are coming for consultation,
so
and those who want to connect with
pleasure.
you too. Thank you so much. We'll take a break, and when we come back, more is coming up.